A £500 million business plan mapping out key changes in hospitals in North West London aimed to turn Ealing from a major hospital into a local one. Changes introduced last month still have to be formally approved, but they include closing down the children's ward and reducing accident and emergency services. But Ealing councillor Dr. Aysha Raza says she fears this is just the start.
The unspoken truth is that, yes, it is very much sort of a death by 1,000 paper cuts. Nobody talks about it. It's all very, no, that's not happening. Everybody will be very, very cagey to speak about it. But realistically, we can see this sort of pattern across the country where hospitals are being closed and they won't be reopened because you'll never have that pot of cash to start them up again.
The changes implemented so far mean that patients have to travel outside the borough for some treatments. The charity Healthwatch believes it's unfair as journeys can take up to 4 times as long.
The NHS is moving the healthcare to a less accessible location. It's as if the NHS is asking everybody else to take in the consequences, the adverse consequences of their proposals. And they keep metaphorically putting their fingers in their ears. It's unfair for any of us to do something which we then expect other people to pick up the consequences.
To get to Ealing Hospital from Southall, one of the borough's most deprived areas, it would take one bus ride, taking around 20 minutes. Now, patients may have to travel to Hillingdon, West Middlesex or Northwick Park hospitals, all of which take much longer. To get to Hillingdon, they would have to take 1 or 2 buses, a journey that takes up to an hour. West Middlesex is a 40-minute journey taking 2 buses, or Northwick Park, a journey members of the council's Transport Scrutiny Committee tested for themselves. It took 3 buses, and even during off-peak times, the journey took an hour and 20 minutes.
It's just not good enough. Frankly, I can't see people just popping in to see a relative. I can't see people without actually factoring half a day off work, coming for an appointment.
Speaking on the journey times, TfL have told us since the changes, they have rerouted buses, increased capacity and frequency of services, but yet the journeys still take much longer. We also reached out to Ealing Hospital. They said it will not be closing. This is changing into a new style of local hospital, providing people with services they use the most, including a local A&E. It said if the reorganisation does go ahead, it will improve healthcare in the district, and the borough will benefit from a £300 million budget earmarked for North West London local hospitals.